Welcome to Insurance Claims Processing Training presentation. The duties of the Accounts Receivable, Insurance Billing, and Collections Specialist. You will be tracking how much money is owed to the practice for services we have rendered and billed, submitting, following up on, and appealing claims to insurance companies in order to receive payments for services rendered, trying to reduce the delinquency for assigned accounts by collecting payment. All three work hand in hand, and you will be able to establish a steady workflow. There are three different types of insurances. You have government, commercial, and Blue Cross and Blue Shield, or BCBS, which is neither a for-profit, privately owned company, nor is it a program that is run by the federal government. Managed care. You have an HMO, which is a health maintenance organization, a PPO, which is a preferred provider organization, POS, which is a point of service, and indemnity, which is fee for service. The life cycle of a medical billing claim. First, you register the patients. Then there's the establishment of financial responsibility for the patient check in and check out, checking for coding and billing compliance, preparing and transmitting claims, monitoring payer adjudication, generating patient statements or bills, and assigning patient payments and arranging collections. ICD-10 codes. In 1990, the World Health Organization, or WHO, approved the 10th revision of International Classification of Diseases, the ICD. They are alphanumeric method of coding that includes every disease, disorder, injury, infection, and symptom there is. It consists of 3 to 7 characters, begins with a letter, and has a decimal after the third alphanumeric. There is an ICD-10-CM, which stands for Clinical Modification, and an ICD-10-PCS, which stands for Procedural Classification System, which is mainly used in hospital situations. CPT codes. CPT, Common Procedural Technology Codes, are numbers assigned to every task and service a medical practitioner may provide to a patient, including medical, surgical, and diagnostic services. CPT codes are 5-digit numeric codes with no decimal marks. The AMA, American Medical Association, maintains these codes. There are 2 levels of CPT codes. Level 1, used for services and procedures usually provided by physicians, and Level 2 codes cover medical equipment, supplies, and ambulance services. The differences in ICD-10 and CPT codes. In ICD-10 codes, they are used for diagnoses, the reasons, coordinated by the WHO, used for billing, research, and statistical purposes, and are alphanumeric, 3 to 7 character long. In CPT codes, they are used for procedures only, coordinated by the AMA, only used for reimbursement purposes, and are 5-digit numeric sequences. HCPCS codes, Healthcare Common Procedure Coding System, are a collection of codes that represent procedures, supplies, products, and services which may be provided to Medicare beneficiaries and to individuals enrolled in private health insurance programs. There are 2 levels. The first level is CPT codes. Second level is HCPCS 2, which are alphanumeric, start with a letter and followed by 4 numbers. They're managed by the CMS, Centers for Medicare and Medicaid Services. The CMS 1500 form is the standard billing form. The National Uniform Claim Committee, or NUC, is responsible for design and maintenance. The electronic version is the 837. Filling out the CMS 1500 form. The top 11 boxes indicate who the patient is and which insurance will be billed. The middle section shows dates of disability, dates of hospitalization, the dates of illness, and other pertinent dates. Section 24 shows the ICD codes. There's also a box here that links ICD codes with the CPT or HCPCS codes. Block 25 through 33 indicate the billing provider and rendering provider, and the last few lines include individual MPI and group MPI. Collections begins when there is a balance due from the patient, usually coinsurance, copayment, or deductible. After a balance has been on the account for an extended period of time, there's a series that happens, usually a letter within the first 30 days, a phone call and a sterner letter at 45 days, phone call at 60 days, and then reported to a collection agency at 120 days. There can be a bad debt, which is only a debt, and uncollectible for extenuating circumstances, which changes depending on the payer. Explanation of benefits, also known as EOB or Summary of Benefits, Remittance Advisory, Coverage Determination, or Beneficiary Notice. It's used by commercial healthcare insurers and government healthcare programs to notify their beneficiaries of how an individual healthcare claim was processed for payment, informs a patient of what is included in their healthcare claims and how it was processed according to the terms of their coverage, can be used to detect fraud and abuse by actively enlisting beneficiaries to report suspected fraud and abuse. Thank you very much.